Everybody, I just want to thank you for joining today, and we'll start out with, it's going to be really informal. I'm going to give a little, maybe 20-slide talk, and then we'll just open it up to questions. And really, I want, maybe the end of the talk is all about how do we open up safely and when do we open up, and that's really where I want to start focusing some things. But we'll start out with this one. I saw this a couple days ago, or a month ago maybe, and I thought it was great. So, yeah. For those of you that don't know, the Donner Party pretty much cannibalized themselves up here in the Eastern Sierra when they were trying to cross in the 1800s. Anyway, I just wanted to start out by saying thank you to everybody for all the sacrifices that you've made. You know, what the national response to this has been amazing, and I think, speaking on behalf of Rob Howard and myself and my brother, to those of us in medical care, it really has made a difference. So really thank you for everything that you've done. We'll move on to this slide. This is a basic slide of what the coronavirus looks like. You know this, you've seen this in the newspapers, but I think what's important to know is that we are exposed to the coronavirus all the time in terms of the common cold, but every once in a while, a variant of the coronavirus changes and it forms something serious. The MERS virus, the Middle Eastern respiratory virus, the SARS virus, and now this COVID-19. And so now we're in this strange situation. Want to talk a little bit about DNA and RNA. And so DNA is on your left. It's that double helix structure. Think of DNA. DNA is the way we carry our genetic material, but I want you to think of DNA as kind of like an old wise man. DNA is stable. It's methodical, it doesn't like change, and it produces a reliable product every day, and it's highly, highly predictable. RNA is almost the opposite. Think of RNA as kind of like a teenage 16-year-old boy. It's unstable. You know, one day it wants to be a fireman, the next day it wants to be a math teacher, and the next day it wants to join the army. And so you never know kind of where it's going. You know, it procrastinates on its homework, and then it wakes up and it scribbles it down last minute, and there's a lot of mistakes, kind of careless errors in it, and it's highly unpredictable. That's the point. Coronavirus is an RNA virus, so it's highly unpredictable. Also, coronavirus is what's called a novel zoonotic virus. So that means that it comes from animals. So every once in a while, an animal bites or spits or scratches a human in the middle of the jungle, and that one human gets sick. And likely that one human will either get sick and get over it or get sick and die, but it never, ever transmits to another human. And then once every very rare while, the RNA changes because it's unpredictable, and it can go now from human to human. And that's a problem. Then add into that the fact that in that rare instance when that happens, it happens in a city which is 11 million people in population, such as Wuhan is. Just to put it in perspective, New York is about 8 million. So a high density population that now can go human to human, that can get transmitted through both droplets and aerosol. And then we have a real big problem. Add into that the way we trade these days, international trade and international travel, where we're highly connected. And then add into that what's called a lean supply chain system, where we rely on getting products the next day, so that our supply chain and our supply stock is very limited, so that if we run out of stock in a pandemic type situation, we have shortages. Now we've got a real big problem. And that's really what we're looking at right now, a highly unpredictable virus that transmits fairly easily in high density populations with world connectivity the way we are, and low supply chain and stocks. Just to put this in perspective, China is probably going to take a lot of blame for this, but to really put it in perspective, had this disease started in another country where we know viral pandemics start, such as the Congo or Yemen, where we have 10 or 20 physicians per 100,000, and there would be no way to control that, we would have had a much bigger problem. And I think when we're all done with this pandemic, one thing the entire world is going to look at is how do we solve the health problems on these third world countries that have been identified that create these viruses? Because if we can solve that health problem, that directly affects us. Okay. This is kind of what it looks like. On your left is a normal lung x-ray. On your right is a COVID-19 X-ray that was taken here at our hospital. It's almost like a whiteout. And what we're seeing is what's called a cytokine inflammatory storm. So all the inflammatory markers in the body are elevated, and it causes just massive inflammation around the lung. If you were to look at a lung is almost like a tree, but upside down. It's got a main stalk and it's got branches, and off of those branches are leaves, if you will. And those leaves are called alveoli. And those alveoli are where we get exchange between oxygen and carbon dioxide. And that's a one cell layer thickness. So if we were going to take that leaf or that alveoli and take it over to the next slide on the right, you can see it. The half on the left is a normal alveoli, and the half on the right is a very sick alveoli. So it's full of inflammation, and that exchange between the alveoli and the red blood and the blood vessel is compromised, so that we can't breathe. And that's really what's going on with this disease. So that we get to the point where we were, within the last month, where we don't have the medical supplies to save people, and we have to make some very difficult decisions. This brings up the way we deal with mass casualty, and that is not everything for everyone, but the best for the most. And so it's a real paradigm shift. And that's really where we've been for the last month in terms of everything that you've been doing in terms of flattening the curve. Any questions so far on that? All right, so let's look at kind of where we are today. If we look at infection rates today in the United States, we are still on the uptick. This is overall United States numbers. You heard today from New York that we may be kind of rounding the corner, but in terms of the whole country, we're still on the uptick. And the numbers today really reflect what was happening with the disease a few weeks ago. So if we look at the number of deaths that are occurring today, that means those people were infected 3 to 4 weeks ago. If we look at the number of active cases that occur today, that's reflecting the number of people that were infected 2 to 3 weeks ago. And if we look at new cases, that's reflecting what happened just a couple weeks ago. And this is looking at what's going on with New York today. When you heard Governor Cuomo talk about, some positive light at the end of the tunnel, today what they saw was a 2-day decline in the number of new cases. That means that starting 2 weeks ago, the disease is starting to taper off. We're still going to see deaths, and we're still going to see active cases for a couple of weeks to follow. But this is actually really good news for New York, not necessarily for the rest of the country, for New York. Okay, so now let's look at this slide. If you go back, we have to always, when we set out a goal, we have to stay with the goal. Otherwise, we get into something called mission drift, and we don't want that. The original goal of this whole project was to prevent hospital saturation to the point where we didn't have to make difficult decisions. The second original point was to prevent dangerous rebound curves, because we know that happens, especially with the Spanish flu. We saw that happen. And the third goal was to stand up the economy no later than necessary. And so all the discussions today and yesterday and the day before were about when do we stand up this economy and when is it the right time. If you look at that black arrow on the left of the curve, that's probably where the country is right now. It's tough to estimate, but that's probably the best estimate of where we are. If you look at the orange arrow next to the right, that's probably where New York is right now. But remember, New York is kind of leading the charge, so the rest of the country is going to lag behind that. If you look at the green arrow way down at the bottom, the green arrow was an arrow that was described, or a point on the curve that was described by a gentleman by the name of Murray at University of Washington. And he kind of theorized way in the beginning of this that if we went to 100% lockdown, 100% shut down all 50 states as of a day, I think it was the first week in March, that by June 21st, we would completely eradicate this disease. Now that sounds good, but it doesn't really fulfill the other goals. It would completely destroy the economy to do that. And so there's a balance to that. But it would prevent the dangerous second rebound curve, and it would prevent hospital saturation. That's never going to happen. And so that's not reality, that's theoretical. So now we have to look kind of further up on that curve to see when is the sweet spot, when's the right day to re-enter, and how does that look with 50 different states and 50 different cultures. If we look at the red arrow, And the red arrow would be something similar to New York and New Jersey and maybe even Pennsylvania entering back into normal economy tomorrow or next week. What would likely happen is we'd see a second rebound curve, and then we would shelter in again because we'd know it'd become dangerous. And then at some point we would release. And if that release was premature, then we would see a third curve and then a fourth curve and a fifth curve, and it would look like a roller coaster. And that's kind of exactly what happened with the Spanish flu in 1918 is they kind of sheltered in and then they let go, and they sheltered in, they let go, and they didn't have their timing right. So what's the appropriate timing? And this is something that we're trying to figure out. It's very complex and it's very strategic, and it doesn't help that there's 50 plans out there. So let's look at some of the plans. Any questions so far on that? Okay. So this plan was put out now about 14 days ago. It's called the National Coronavirus Response, or a Roadmap to Reopening. And this is kind of the basis for all of the 50 governors' plans and also the president's plan. If you look at them, if you study them, they're all kind of very similar. They vary as to when the start date occurs, but the kind of basis is the same. And they all basically say that they will reopen their state when there is a consecutive 14-day decline in cases. Now, New York has seen 2 days, okay? And again, the rest of the country's behind that. That's the first trigger. The second trigger is when there's no hospital saturation. So no hospital in the state, or in the case of, let's say, California, we're in a tri-state kind of union now between Washington and Oregon. When there's no hospitals that are saturated in the tri-state area, that's another trigger. When all of the vulnerable populations are protected, so people in nursing homes, people that have other diseases, when they're protected, that's another trigger to open. When we have testing available for everybody that has symptoms, and this is a big one, and we're nowhere near that yet. And finally, probably the most important one, when we have the ability to what's called contact trace, meaning if Rob Howard is sick, we need to trace down everybody he's talked to and come into contact with in the last 14 days. And all of those people then need to go in isolation. And in an ideal sense, isolation isn't in the home. Ideally, it's in a hotel room, because all we're going to do in the home is just infect other people in the home. And somebody's got to go out for groceries and somebody has to go to work. And so if you're watching the news, this is what happened with Chris Cuomo, the governor's brother, right? He went into isolation and now his wife's sick. And that's very, very predictable. But these are kind of the 5 triggers, if you will, for all of the plans. And Pennsylvania is now in a combined plan with New York, New Jersey, Delaware, Massachusetts, and Connecticut and Rhode Island, I think. I think it's a 6-state plan, and they're all pretty much on the same page. And that makes sense given the travel patterns and how close and how dense that the Eastern Seaboard is. So if you look back at that curve, what that really means is, if New York is here and we consider New York, Pennsylvania, New Jersey, and Connecticut and Rhode Island together, we can't open up today. Okay, that's not going to happen, because what's going to happen is we're going to get this second and third curve. If we open up June 21st, we're going to destroy the economy completely. We've got 22 million people out of work. So it's got to be somewhere, kind of in between those 2 spots, and it has to be when those 5 triggers are hit. And there's a lot of work to do between now and when those 5 triggers are hit. This is what happens when you open up too early. Singapore had probably the best response to COVID of anywhere in the world. They were the model country. They shut the entire place down. They tested everybody and they isolated everybody. And if you look at their curve, remember they sit right next to China and there's a lot of travel between the two. They shut that travel down. And look at their curve all the way through March. And then about a week ago, they opened up, or 2 weeks ago, they opened up. And they opened up pretty much fully, okay? They did what Philadelphia did in the Spanish flu, and look what's going on with their curve. They're jumping rapidly. So they prematurely opened. Something else we have to consider, and this happens in pretty much any mass casualty event, is we see a curve of the initial spikes, disease, we see a secondary curve, and then there's also always something called the third wave. And the third wave is violence. And if you look across the country, what you're seeing is domestic violence rates are going up, child abuse rates are going up, crime is starting to tick. You're starting to see protests. In California, there was a general stand down of all police officers responding to domestic violence events. They're no longer responding to this. And so they're just letting it happen. And so this is where we don't want to be. And so we have to think about that too. So now let's look at how do we open up. Any questions so far on that? All right. If you took that blueprint plan and you graphed it out into phases, and they talk about phases of reentry. Can you see my cursor?
Yeah.
Okay. If you look at phases of reentry, well, in January we were in considered phase 0, normal life. Everybody was doing what they wanted to do. And then we had a disease curve that happened, this green curve, and we went into what's called phase 1, and that's shelter in place pretty much everywhere in the country. We shut down business, we shut down schools, and that's kind of where we are now. At some point, we have to get to phase 2. That's going to occur sometime between now and June 21st. I think it's probably going to be sometime in May. And most of the governor's plans look at April 30th to May 15th, somewhere in that area. I think April 30th is probably too early, and I think we're going to get burned on that. And I see Rob shaking his head, but we don't know. But when we hit all those triggers, then it's time to go. Then we're going to move into phase 2. So what does phase 2 look like? Well, likely phase 2 means we reopen business very cautiously. We reopen schools very cautiously. We maintain a distance of at least 6 feet. We maintain masking. We have hygiene in all businesses, meaning soap or hand wash containers. We limit the amount of people that are in one space at one time, which means we likely spread out the day. Instead of having an 8-hour day, we spread out the workday into 12, maybe 16 hours. And look at how long that phase 2 lasts. Phase 2 lasts from when we hit that trigger all the way up to the time that we hit phase 3, which is when the vaccine comes. Likely the vaccine is going to take over a year, probably a year and a half. And that vaccine is going to be given in order in society: healthcare workers and fire and police first, old people next, middle-aged people after that, and school kids after that. That's probably going to be the order that it goes, which means that our kids are going to be getting this vaccine September to December of 2021. So now we got to think about, how do we exist? How do we stand up the economy? How does Steve run his business as a restaurant owner in this next year to year and a half, and still keep his business open, still keep paying his employees, but do it radically differently, right? How does he have a restaurant with people wearing a mask? Does he, instead of serving, lunch and dinner, does he start serving breakfast as well, so that he can see the same amount of people in one day, but the days spread out? And we're going to talk in a second about competitive business advantages to complying with this, because what we're seeing here in my town. So my town is 100% tourist based as a ski area. About 80% of the town is unemployed at this point. And everybody's itching to get back, as you can imagine. We have, probably 3,000 out of the 8,000 people in town in a bread line every day. I mean, it's serious stuff. And so the businesses, especially the restaurants, are trying to figure out innovative ways right now to get back. And they're doing, takeout, they're doing, virtual dinners. But likely when we open up here in California, they're going to spread their day out. They're going to have takeout. They're going to have food trucks that serve outside. And they're probably going to be identified as either a safe restaurant or a not safe restaurant. And if they're identified as a safe restaurant, that becomes a competitive business advantage to them. They're probably going to get some kind of gold star, if you will, from the health department to saying they're complying. And so these are just kind of the things that we have to think about. Phase 3 is defined as the vaccine. Phase 4, if you look, the level of phase 4 is higher than phase 0. That means we as a society got better. By learning to wash our hands, the flu season will probably be less. By learning to wash our hands, we'll probably have less surgery site infections. We may now learn how to develop vaccines faster. So there's a lot of things that we can learn from this. And importantly, our biodefense is going to be much bolstered. So the ability to fight terrorist events from a viral or bacterial standpoint is going to be a lot better. But that's what phase 4 looks like. We're really worried about phase 2. Important in this plan is the ability to fall back and flex backwards, so that if we open up into phase 2 and we see that there's a reaction of the virus to that, meaning the virus spikes again, the entire society needs to be able to flex back to phase 1 immediately, meaning going back into shelter in place. And I think for those of you that have employees or those of you that have students, preparing them now for this kind of going back and forth for a while, this little stutter, I think is really healthy, because when people have expectations, they deal with it a lot better than if they don't. And so I do believe, and Rob, I'd be interested to hear your comments on it, but I think that some states are going to open prematurely, and we're going to see this second spike, just like they saw in the Spanish flu. They actually saw a third spike. In fact, in the Spanish flu, the third spike was bigger than the first spike. And I think that we're going to have to be able to flex back quickly, kind of hide in for 2 weeks. Why 2 weeks? Because that's one viral cycle, and then open up again very cautiously. Any questions?
Yeah.
Yeah.
No, Mike, I was going to say, I totally agree with that. The other thing, I think we're going to have varying rates of compliance with the social distancing as well, which, I mean, we already see that, around, like, people are getting tired of this. And, of course you see everything in the news with Michigan and things like that. Amy and I were coming home and we saw a group of about 12 guys out playing, full court basketball on the way home today. So, from getting something to eat. So, some of that is going to play in there as well. I'll have some comments about the kind of the local thing here for Berks County, but I'll do that after you finish up here.
Yeah, Rob, I agree with you. I think, we're starting to see the levee break here in California. There's no question about it. And are we going to be able to hold out as long as the governor here? This governor is led the charge, and California is doing extremely well, given we have the highest population in the country, but we have some of the lowest rates. But that's because we sheltered in almost 5 weeks ago, and it's going to break, and I think it's going to break early. That's what I'm seeing too. Okay, one last slide, and then we'll kind of open. And I think Rob wants to kind of update everybody in Berks County and Lehigh County. But so how do we do this? Like, what are the strategies that somebody like Steve can use in his business, or Tom? I don't know if Tom Fenstermacher's on, but Tom owns a bunch of gyms. And Shelby Brett is a school teacher. How do we get the kids back to school, and what sports are they going to be playing in the fall? How do we do this? So on the y-axis, on the left here, vertical, is safety. And it doesn't matter if you're talking about safety of patients in the hospital, or safety of patients in Steve's restaurant, or in a gym, or kids in school. It's just safety. And so in January, we had a certain level of safety in our society that was pretty high. And then this virus came along and we dropped down to this very low level of safety, so low that we had to stay in our houses. And then at some point, there's going to be this trigger point. How do we do it? This is kind of like walking out on thin ice. And so if you were going to walk out on a pond with thin ice, you wouldn't run out and start jumping on it. You'd kind of take one step at a time and test it. And that's the way I think it's going to probably have to happen if we're going to be smart. That means that somebody like Steve tests the water. And, if he was operating at 0% business, I don't know where you've been, Steve, but let's say 0% business, maybe you jump up to 25% of where you were in January, and test your systems. What's it like for people to wash their hand before and after they enter your restaurant? What's it like for people to eat in a mask? What's it like to fill every other seat? And what's it like to serve breakfast? And then just see what happens nationally and locally with your curve. Because if you only open up 25%, to flex back to zero is pretty easy. And then, after one viral cycle, 2 weeks, maybe bump it to 50%. And can you see, more people in your restaurant, but still maintain the same safety measures? And with school, let's talk about school. How are you going to fit? I don't know what your ratios are in school in Pennsylvania, but in California, we have 35 kids in a classroom, and they're talking about going to 40 this year because they're cutting back on teachers. How do you put 40 kids in a classroom and maintain social distancing? You can't. And so does that mean that kids are in the gym? Does that mean kids start school early and some kids start late? Does that mean we start using, not telemedicine, but teleschool as an adjunct? We're going to have to think out of the box here, because at some point we're going to have to get back safely. Um, and there's other examples, but I think the point is we all want to get back, and now it's up to our ingenuity to get back safely. And there are ways to do it. It's just we got to kind of test the water as we get in. One thing to consider: if we all jump in on the thin ice, on April 30th, we're going to have a rebound and a rebound and a rebound and a flex back and a flex back and a flex back, which means the economy is going to be compromised for a longer period of time than if we do it right. Okay. And I'll just kind of leave you with that and open things up to questions. Or Rob, you were going to talk about maybe Berks County and
Yeah, just shortly, Mike. That's a great summary. You did a great job there, and I think that gives a very good kind of overall look at what we're dealing with. What from a local standpoint, Berks County wise, we've been pretty lucky so far, in at least in the healthcare arena. We were initially predicted to have a peak a little earlier, probably like last Monday, and we didn't really see that, and some people, including myself, were thinking, oh, okay, well maybe we're kind of dodging this bullet more than New York. Now, what I can tell you is that over the last 48
Mike
hours,
just did a really good job of explaining it.
we had a dramatic increase in cases and also in death rate in Berks County. And so we're definitely behind New York. You said I was shaking my head. We're not near ready to open up yet. All the plans, the president's plan with the CDC and everything all calls for 14 days after you peak and start to decrease your incidence. And so we're not there yet. We're still going up. And so I'm hoping that happens, that we peak this week and that we start to see some trending off, and that, that 14 days isn't more than, 16 or 18, 21 days from now. I'm hoping that that's what the case is. From a general health perspective for our local areas, we are in a good situation from a availability of ICU beds, ventilators, all the things you talked about, or you hear talked about on the news. Ironically, one of the things we're finding out from a medical standpoint is that while certainly some people are needing to be placed on the ventilator, that probably doing a little bit of permissive hypoxia, or prolonging the time till people go on a ventilator, or maybe even hopefully avoiding them having to go on a ventilator at all, may be a better treatment course if we can do that. So that's one thing we have right now. Now, hopefully things don't get dramatically worse in the next few days, but right now we're nowhere near our capacity in Berks County as far as ventilators and ICU beds. I have a dashboard that I look at, and we right now in Berks County, I think we only have 18 people who are on a ventilator for COVID-19, which is really good. There are actually more people on ventilators for other diseases right now in Berks County than there are for COVID-19, and there's still an availability of at least 100 ventilators over what we're using right now. So from that standpoint, we're doing well. One of the things from the very beginning, we are a little bit vulnerable, I think, in my opinion, in Reading, just because of the city of Reading itself. I think that is just like New York City. It is much more densely populated. You have households where there are a lot of individuals living in the same household who once one of them gets it, they will all have it. And so that is where I think we could run into trouble Berks County wise, as far as, and again, hopefully we don't get there, but some of the things that you saw in New York City where where the system was really stressed, that's where we could get to that. I don't think we're going to get there, and I think that's because everybody's done a very good job so far with this whole flattening the curve thing. So I don't think we're going to get there, but that's a possibility. We're definitely in Pennsylvania. We're definitely behind New York, and then if you look at a map, it's pretty obvious how this thing spreads. I mean, you saw it go from New York City, where obviously it was going to spread down the Jersey coast because there's a lot of traffic and travel through there. Then it gradually gets into Philadelphia. Now it is creeping into Montgomery County and Bucks County, and now into Berks County and Lehigh County, and kind of working itself across. And that, obviously, that makes sense because it's just pure physical contact. And so I think we're going to be good. I think hopefully we're going to hit the peak of our curve and then get on to the things that you were talking about, Mike, as far as opening up. I agree that is going to be a delicate ballet. It is going to be try things, see what happens, and hopefully society is going to be cooperative with that whole process.
Yeah. And again, so that we don't get into mission creep, the whole goal was to get to the point where we didn't saturate hospitals. It wasn't to kill the disease. So that as we, the trade-off, we have to start the economy. I mean, there's no question about this. We are in serious trouble if we don't start the economy. But the trade-off is, by doing that, people are going to get sick, and they're going to die. And that there's no question that that's going to happen. There needs to be this balance of starting up the economy at a slow, kind of gradual pace, so that we don't then saturate again. That's kind of the trick. And yeah, it's so anyway.